Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Hello, everyone, and welcome back to the Skin Sync podcast. This is Bucci Nita from the Atlanta, Georgia area, and I'm back with my Elevate colleague and co-host for the day, Lisa Weiss. Welcome back, Lisa.
Thank you so much. I'm so happy to be back.
So we're excited today because we have a really interesting topic to talk about. We're going to be diving into the fascinating connection between skin health and overall body wellness. We have a guest today. She's a PA specializing in dermatology with a functional medicine approach. So I'm going to introduce Kerry Jenkins. Kerry Jenkins is a dermatology clinical expert and founder of Whisper Health, a functional medicine practice helping children and adults heal chronic skin conditions from the inside out. With 25 years of dermatology experience and advanced training and certifications, she blends evidence-based medicine with a compassionate, holistic approach. Her journey into functional medicine began with her daughter's digestive issues and a pivotal encounter with a teenage patient seeking answers about diet and disease, answers traditional training never provided. That moment solidified Kerry's plan to identify underlying root causes and offer natural paths to clear skin without harsh medications. Known for her humility, warmth, and lifelong commitment to learning, Kerry empowers families to restore health, confidence, and balance through integrative dermatology. I had the pleasure of meeting Kerry at our recent Rapids conference in Fort Lauderdale, and she was a pleasure, and I'm really excited to talk to you today. So welcome to the podcast, Kerry.
Thank you so much. It's such an honor and privilege to be here with you ladies tonight.
So before we jump into your functional medicine journey, let's talk about just dermatology. How did you get into derm? What drew you into the specialty to begin with?
It's kind of funny. I graduated PA school in 2000. And immediately upon graduation, I started applying for internal medicine and family practice positions. And one of my friends in my graduating class said, "Hey, the dermatology practice that I just got hired with 6 months ago is looking to add another PA. Would you be interested?" And I thought, nah, I don't want to pop pimples. And there's so much humility now when I look back as to what my attitude was and the stereotype that I had in my mind. I didn't know what I didn't know, but fate has a funny way of working. And she just invited me to come down and meet the practice manager and the docs in the practice. And I said yes. And I just December of 2025 walked away from that practice. I was with the same practice for 25 years.
Oh, wow. Well, this is a
Wow.
recent start. Okay. And you said 25 years in dermatology and you made this big shift.
Yes.
That's bold. It's a bold move.
Yes. So I started my functional medicine practice 8 years ago,
Okay.
and I slowly started weaning myself out. I was 3 days a week. I worked part-time, and then I went down to 2 days a week. And all the other days of the week, I was doing my functional medicine practice. And then I weaned down to 1 day a week. And I worked 1 day a week for about a year. And then finally, the universe spoke to me very loud and clear and said, "It is time, girl, for you to walk away from this completely and do your own thing." And so I did that December of 2025.
That's
Congratulations.
amazing. Good for you.
Thank you. It was a terrifying leap of faith, but I have the confidence and really the trust that the universe has my back and that I am on the right path and doing the right thing. This is truly my calling, and everything's going to work out.
That's great. We're so excited for you, and we're so excited to have you here.
Thank you.
Give us a little bit of information about the skin-body connection and how you educate patients on root cause medicine.
So this is really where my passion lies. I love talking to my patients and educating them. The skin is really an outside reflection or a mirror of what is happening on the inside of the body. So I always tell my patients that the skin is a window and you're looking inside the gut. So if the gut is inflamed and it's a train wreck, then your skin is going to be inflamed and a train wreck. So it's really, the gut skin connection is profound. And I don't know about you guys, but when I went to PA school, there wasn't any talk about identifying underlying causes. There wasn't any talk about gut microbiomes and how the gut affects the brain and how the gut affects the skin and how the gut affects the lungs and how the gut essentially affects everything. So that was all secondary learning, but really our gut is really our first brain. And if the gut's not happy, there's nothing else systematically in the body that is going to be working optimally. So when we start identifying chronic stable skin conditions, which is what I specialize in, the very first thing I do is to dive deep into the gut microbiome.
Love that. So before we get much deeper, can you kind of define, because I feel like there's so many terms out there. We've got functional medicine, integrative medicine, alternative medicine. What does functional medicine actually mean? Is it kind of a collection of all those things? But what's the definition of functional medicine?
It really is a collection of all those things. So the way I look at it is functional medicine is identifying how your body's systems are functioning. And for the majority of society, their bodies are highly suboptimal in their functioning. And a lot of people feel that in their body, and a lot of people don't feel that and just think that their aches and pains and fatigue and headaches and all the things are just a normal part of them aging. But in reality, integrative medicine, the way that I look at that is combining conventional medicine with Eastern medicine, like traditional Chinese medicine. These traditional Chinese medical doctors have been practicing medicine for tens of thousands of years, herbal medicines. That's where medicine really, really got started. So integrative medicine in my mind is a combination of that traditional Chinese medicine and conventional medicine as we know it today. It's that combination. I practice functional medicine. I want the body to function optimally. I'm not anti-drug. I'm not anti-medication. I'm not anti-vaccine. I'm not anti anything that conventional medicine does. And I also have a tremendous amount of respect for what these traditional Chinese medical practitioners were doing tens of thousands of years ago. So I really kind of look at it as a marriage or an integration of both of those aspects of medicine.
So really complementary to everything.
Everything, yes. Yes.
So let's chat about acne. It's a big thing that we see that patients really want to talk about alternative ways to treat. So how do you treat your acne patients when they come in to see you?
So we're always looking at the individualized person. Is it a 17-year-old active male athlete? Is it an 18-year-old PCOS female? Is it a 32-year-old adult female that's having more papulopustular? We've got to identify what is the acne that we're seeing? Where is it located on the body? Is it only on the face? Is it also on the chest, the shoulders, and the back? The way that I work up my acne patients is I'm always doing conventional blood work. I'm doing serum nutrient labs. I want to take a look at a CBC, a CMP, a vitamin A, a zinc, a vitamin D. Those are nutritional cofactors for a very happy, healthy immune system. I am always doing a comprehensive digestive stool analysis, which is giving us insight into what's going on in the gut microbiome. It's showing us who is present in the gut microbes and in what type of quantity. It is showing me if there's any opportunistic overgrowths, like H. pylori or candida, or if there's parasites, giardia, blastocystis. There's so many little creatures that we can pick up in our worldly travels, right? So I'm looking into the gut microbiome. I'm taking some blood and looking at nutrient sufficiencies. And then I also do a urinary organic acids test, which is just another advanced diagnostic test that functional and integrated practitioners used to help identify a yeast overburden. Because in so many people, there is an overburden of yeast in the GI tract. And this is not an acute thrush infection, right? We're not talking, acute things, but this is just an overgrowth of candida yeast. So I use those three diagnostic tools to identify what's going on. And then we're able to make an individualized treatment plan based on the data that we find. So acne is never caused by just one thing, right? Hormones are involved, stress levels, cortisol production, insulin, your metabolic system. There are so many drivers of acne. And the beautiful thing about the functional medicine practice that, I have created is I get to spend a substantial amount of time with my patients, educating them, like we talked about. And we're working in the 4 pillars of health, which is nutrition. What are they eating? How well are they sleeping? How much movement do they have in their daily life? How are they managing their stress? And those 4 pillars of health, along with getting the diagnostic data, really allows me to say, okay, if it's a, 43-year-old female who is perimenopausal and highly stressed because She's caring for aging parents and she has teenage children and she's a single mom and she's working 3 jobs. Her cortisol levels are high. She's not sleeping very well. She's got financial stress. That's a very different acne case than the 17-year-old male athlete, right? So we're really diving in and figuring out what are the driving forces? What can we do to help balance? What does the body need that it doesn't have? What does the body have that it doesn't need? So we take away what it doesn't like. We give it what it likes and magic appears. Acne is cleared.
I think you just described me, that patient you just mentioned, who's stressed out and
Yeah.
overwhelmed.
Yeah, and there's so many of yous out
Yeah,
there, right?
absolutely. And
You just convinced me that I wanted to be your patient while you were describing it.
And
Yeah.
one thing that was to kind of tie into what you were just saying. So I'm certified in lifestyle medicine and we have the 6 pillars, right? So you've got the 4 that you just mentioned. And then with lifestyle medicine, they add on avoiding risky substances like alcohol and tobacco and encouraging more social interactions, right? So that social connectedness. But again, all of these specialties really just kind of tie in and complement one another. So I think that's wonderful. So this might be a loaded question, and I want you to break it down as simply as you possibly can, because I know we can probably spend an hour discussing this. But let's talk autoimmune disorders, because I feel like that's one of the driving forces for patients seeking functional care, at least in dermatology, where they feel frustrated that we cannot help them with traditional medications. I think a lot of clinicians aren't asking the questions that you just talked about, like how is your sleep? What are you eating? How is your stress? And patients get really frustrated and they're willing to seek other cares. I'm that patient. I've done that myself. So, kind of tell me more about that. And specifically, I also want to know about that lupus patient that you mentioned earlier in your career that kind of was the big kind of clue that helped you find your way into functional medicine.
Love that you ask about that. Autoimmune process is one of my absolute passions. And I feel as though with what has happened in society over the last 6 years, the amount of autoimmune processes that are now starting to come out of the woodwork is exponential. And there's just not enough practitioners to be able to support the amount of patients that are being diagnosed. And let's not forget that your typical autoimmune patient goes undiagnosed for something like 7 to 10 years before they're properly diagnosed and able to get down the right path. So, autoimmune processes have multiple drivers. One is a genetic predisposition. One is a breach in the gastrointestinal lining. And we call that, in layman's terms, we call that leaky gut. And when those tight junctions in the GI tract are broken apart and they open, it is allowing undigested food proteins, pesticides, toxins, and microbes to enter systemic circulation and stimulate an immune response that is not supposed to happen. Our GI tract is nothing more than a garden hose that starts at our mouth and ends at our backside, and it is supposed to be an impenetrable tube that starts at the mouth and ends at our bum. And when we talk about the way that our society lives on a day-over-day basis with the standard American diet, what we're eating, the foods that we take in that we think are totally normal are allowing this intestinal permeability or this leaky gut to just consistently be in this feed forward cycle. The processed foods, the sugar, the dyes, the preservatives, the pesticides, all the stuff that's in the standard American diet in these processed foods are enhancing the intestinal permeability, which is allowing those undigested food proteins, microbes, toxins to leak into systemic circulation, which upregulates our immune system. And now our immune system is saying, Houston, we have a problem. And that sets off the entire cascade in the body where you have these antigen presenting cells in the immune system. Typically, they're dendritic cells. They're constantly sampling. They're taking these tiny little protein samples, whether it's a microbe or a toxin or a piece of self tissue, and it's presenting it to our T and B cells, which is our humoral portion of our immune system. And now all of a sudden the immune system is turned on to self tissue, and that is the birth of an autoimmune process. So it is happening 10,000 fold more post COVID era than it did pre COVID era. And it's just going to continuously ramp up until we can be able to get the medical system to understand that, just like you said, Bucci, we are not asking the right questions. And it's not the practitioner's fault. I'm not throwing shade at anybody and saying, I do it better than you do. I was just trained differently to be able to do it better. And until we can get in the medical educational system and start shifting how we're educating our practitioners, we're not going to get there fast enough, right? We need a whole army of people coming at it from this lifestyle medicine perspective in order to make a difference. But the autoimmune cascade, and like, once you have one autoimmune condition, you are set up for multiple, just acquiring more and more and more of them because the immune system is so dysregulated. And the second part of your question was the lupus patient. I will never forget that child. She changed my life in a very profound way. And it was my last patient of the day, and my medical assistant presented this 16-year-old African-American, beautiful young woman that came in with her aunt and her grandmother. And my medical assistant said, she's here to establish care. And I sat down and put my hands on her and said, tell me what's going on. Why are you here? And she just looked at me dead in the face and said, I was just diagnosed with lupus. My aunt and my grandmother have lupus, and I need you to explain to me how my diagnosis, how nutrition is going to affect my diagnosis. How can I use nutrition to offset lupus from progressing like it did with my aunt and my grandmother, where they are, their joints are absolutely in flames and they can't walk and their knees hurt. And I remember that moment so clearly because it was like lightning struck in my exam room. And I thought, I had been on the edge of jumping off a cliff and starting my own practice. And I had so much fear and so much imposter syndrome, like, you're not going to be able to do this, Kerry. Who do you think you are that you're going to be able to make this work? And I had this angel and devil sitting on my shoulder. And then this young child sat in front of me and asked me this question. And I sat back and said to her, you know what? I don't have the answer right now to be able to tell you how your diet affects your disease, but I will promise you that we will figure it out together. And I will not let you figure this out alone. I will help you. We will take this journey together. We'll figure it out. And that was a pivotal moment in my life. I walked out of that exam room humbled and absolutely paying attention to the universe. Like, okay, the signal has been received. I know what my path is. Thank you so much for bringing it right up in my face.
I love that.
Me too. I mean, that patient changed you and you changed them and really helped treat them. And it's why you are who you are. And we're lucky to have you as a provider.
It was profound. It was absolutely profound. And I told her on subsequent visits how she changed my life. And she's like, well, you changed my life. And I was like, well, you changed my life. It was kind of sweet.
Okay, talk to us about hair loss and how you approach the hair loss patients that come in and see you. We know that stress and hormones can be related to this. So, how do you talk to your hair loss patients?
Again, so we need to identify what type of hair loss are we talking about? Are we talking about androgenic alopecia, where it's, that diffuse thinning of the hair? Is it an autoimmune process? Are we dealing with alopecia areata? Are we dealing with alopecia totalis? Are we dealing with scarring alopecia like lichen planopilaris? What are we dealing with, right? So once we identify what type of alopecia we have, that's where, depending on what type of bucket they fall into, is it a scarring hair loss? That discussion is going to be different than an autoimmune discussion. Is it an androgenic type of alopecia? That discussion is going to be different than scarring or autoimmune. So again, it all comes down to identifying what it is. Every single one of those patients is going to get the foundation. We're talking about nutrition. We're talking about sleep. We're talking about stress management. We're talking about how they're moving their bodies. How much water are they drinking? Are they outside getting sunshine on their body? All of these things play into supporting one's wellness or illness. So it doesn't matter, foundationally, when I'm starting to discuss hair loss with a patient, they all get that foundational education and discussion and workup. And then depending on which bucket they fall into for that hair loss, that's where it goes different.
So I'm going to play bad guy for a little bit because I'm sure you're not a stranger to this. There's a lot of controversy when it comes to functional medicine and functional medicine practitioners. So I want you to kind of address some of those things briefly. Number one being that it's not evidence-based. Number two, the criticism about it being really targeted towards people that have the means to spend on some of the expensive testing and medications and supplements and lab work. So what's your response to those who really are kind of, not believers in functional medicine, anti-functional medicine, or feel like it's all just quackery and, it's not real medicine? How do you address that?
I get real and honest with my patients. And I say, listen, 8 years ago when I decided to jump off a cliff and start my own practice, the reason I'm not 10 years into practice is because I let 2 years of my life be wasted on, should I do it? Is it real? Am I going to be looked at like I'm practicing voodoo or witchcraft? Because I will tell you, up until recently, and I don't know when this happened, but when I was considering starting my own practice, I Googled functional medicine on Wikipedia, and Wikipedia's page basically said that it's voodoo witchcraft. It's not evidence-based. It's a bunch of malarkey. It's nothing but a scheme to completely take money from patients. And I was like, I don't want to be associated with that. I am a medical professional. I went to school. I got my degree. I am licensed in the state of Florida and Georgia. I have to go through these steps to maintain my certification. I don't want to be affiliated or associated with that type of stereotype. So I wasted 2 years of my life unnecessarily on being fearful of what Wikipedia said. So it is evidence-based. And I will come here to say that if you were to Google atopic dermatitis and the gut microbiome, if you were to Google that 10 years ago, there would probably be 100, maybe not even 100, maybe like 25 studies on the gut microbiome and how it relates to atopic dermatitis. Now, 10 years later, if you Google atopic dermatitis and the gut microbiome, now there's hundreds of published studies in PubMed talking about the correlation between the gut skin connection. So it is evidence-based. The problem is that our educational systems are not. It takes 17. The studies are done and published. It takes 17 years for that data to work its way into conventional medical training. So we're always 17 years behind. We're like 2 decades lagging behind. It is evidence-based. It does work. There's a group of us that are really working hard towards everybody having access to integrative and functional medicine. And a really amazing headline came out last week that Parsley Health, that was founded by Dr. Robin Berzin, was just picked up by major insurance carriers.
Love that.
So there are people in the space that are working diligently behind the scenes to gather the data, publish the studies, get the analytics, and put this information out there and get in front of insurance companies to say, hey, this type of medicine works. And if you employ it in these big companies and insurance pays for it, you are saving money in the long run. So we're working really diligently behind the scenes to kind of flip that script that it's only available for the wealthy. We want it to be available to the masses, and we are taking strides to make that happen. It's unfortunate, but it's taking time to make the shift.
It's fantastic.
So give us a few quick tips that we could share with people. We're going to ask you a few quick questions. Tell us, what's one wellness habit that you personally swear by?
Love this. Okay, so rapid fire, I won't talk for 30 minutes, but it's circadian biology. People do not understand that our cells are designed to work on a circadian 24-hour biological clock. Our body is meant to wake up with the sun, have meals at the same time every day, have exercise the same time, have our bathroom habits be the same time, have our food intake. Like, the one main thing is have a consistent circadian biologic rhythm. Wake up the same time of day, go to bed the same time of day, relatively eat your meals the same time of day, keep your workouts the same time of day. And if you can do that consistently over time, that is showing every cell in your body a safety signal. And so many people on our planet are running, going, doing, achieving more, harder, faster, longer, better, keeping up with the Joneses. And that is doing nothing but pumping cortisol and norepinephrine into our bloodstream. And that is the definition of chronic stress, and chronic stress kills us. So if we can be outside, have a consistent circadian biological rhythm, oh my God, the health shifts in the general population, if we could just get that out there, would be dramatic.
I feel like you're screaming at me right now.
Me too.
Like you're yelling at me, telling me this stuff. It's crazy because, I think we know this information, right? A lot of us are interested in this information and seek the certification and have the knowledge, but life just gets stressful and it's really hard and you get into a good groove and something completely throws it off. So I think it's challenging. And I think for me, at least, it requires constant work and constant effort to ensure that you're making those good choices for your body. So thanks for the reminder.
And I love that you said that, because really there's no nobody on this planet that's able to be perfect all the time. Perfect doesn't exist. And just like you said, life happens. There's celebrations that come our way. We stay out late. We might drink one too many. We might eat, not the best food choices. And the beautiful thing is that we always have the choice and the ability to come back and find our center and make the right choice the next day. Get back on track. We all fall off and go into the weeds, every single one of us. It doesn't mean that you're broken. It doesn't mean that you can't do it. It doesn't mean that you don't have willpower. It just means that life happens and you get to choose to go back to doing what you know works for your body.
So
I feel like you're speaking to
yeah,
my soul.
exactly. No, I think we were meant to have this conversation today because Lisa and I discuss this regularly. It's really challenging to juggle all the things that we're trying to do, and we're highly ambitious, and it makes it challenging to really take care of ourselves. So
It is.
as we kind of wrap things up, for those clinicians out there who are actually hungry for this information, and with that said, actually, I want to point out one thing. I do think that the newer PA programs and NP programs are seeing the light and integrating this into their curriculums. And there's one program I speak at here in the Atlanta area where they have a whole series of lectures on the impact of sleep on health, social connectedness, spirituality, the Mediterranean diet. And so I think it's becoming more common. And unfortunately, I
That
think it will
makes
take
me
some time.
so
Yes,
happy.
it's fantastic. And I actually give some of those lectures and I enjoy them probably some more than some of my dermatology lectures. So I'm hoping that shift is happening. But for those out there who want to learn, who are hungry for this information, can you give us like your top 3 or 4 resources, websites, podcasts that you recommend for us to learn more about functional and integrative medicine?
Yes, I really love the Institute for Functional Medicine. The ifm.org is their website. I personally feel that they are the gold standard for functional medicine education. They are an amazing resource for documents, education, so many amazing things on that website. So I really like the ifm.org website. As far as podcasts go, Dr. Mark Hyman is one of the most widely known functional medicine practitioners. He founded, within the Cleveland Clinic, there is functional medicine in the Cleveland Clinic in Ohio. He's got a great podcast. The People's Pharmacy, I think is the name of it. Something pharmacy, but it's FARMACY. The play on words is
Mhm.
exactly what he intended. That's an amazing podcast. There's so many amazing leaders and speakers. Just start playing around with Google. You can go down a rabbit hole and be gone for weeks. Just whatever question you have. And I mean, I'm an advocate. I'm always available. If anybody wants to reach out and say, hey, how do I get started? Can you help me? Can you guide me? I always put myself out there because I remember what it was like when I was starting and I really didn't have anybody in the PA world that I knew of that was doing this. So to pay it forward, I always put myself out there. I will always make time to speak with students, with practitioners. If you're considering education and you want to talk about it and weigh pros and cons of programs, I'm always willing to pick up the phone and have a quick phone conversation, respond to an email, a text message, and help in any way I can. Because I remember what it was like when I started out, and it takes an army. And I feel like part of the purpose, my purpose on this planet is to help facilitate that army, to build that army. And I think us as PAs and NPs, we really are uniquely set up to be able to do this work. So let's go, folks.
I love it. I think I'm a part of this army. I'm excited to be marching with you.
Me too.
Well, this has been fantastic, Carrie. So actually Carrie came up to me at the Rapids conference recently and we had talked about the gut skin axis and she shared some really great insight during that lecture and we decided to come together on this podcast and have this conversation. So I'm so grateful that you were able to do this with us today. I hope everyone listening has taken so much away from this. Our patients are in desperate need of these conversations. And whether they tell you or not, they are looking for it. They are seeking this information out. So Carrie, any final words before we close this out?
Just want to say thank you so much for the opportunity to speaking. It means so much to me that you guys that are on the board of directors at Rapids, you put on such an amazing conference. I went to Puerto Rico last year and absolutely had my socks blown off by the production. Guys, so impressed. And I just want to say thank you for allowing to have these conversations and for putting this information out there. It makes me so happy to have you be a part of the Army because we're going to change medicine.
And shout out to Lisa for being the co-medical director of the Rapids Conference and doing a beautiful job of coordinating
Yay,
speakers and
Lisa.
topics. But thank you, ladies, for being here tonight. We appreciate it. Thanks to everyone listening. And we would love to have you back someday, Kerry.
Thank you so much.
All right.
Thank you so much.
Well, take care.
Thanks for tuning in to Skin Sync. Don't forget to subscribe to Skin Sync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.